Hello, welcome to my channel Dentistry with Keshav. Angina pectoris. An inginal attack during dental treatment is a medical emergency which is caused by reduced blood flow to the heart. The patient may complain of chest pain, pressure, sweating, and shortness of breath or pain radiating to the left arm or jaw. These things could trigger this inginal attack in these patients. It may be due to fear and anxiety. It may be pain during treatment, like your anesthesia is very ineffective. It may be due to long dental appointments, and it may be use of excessive epinephrine in local anesthesia, like epinephrine is a vasoconstrictor, and we know it can increase the cardiac workload. Sudden stress or panic, like you are showing some dental syringes, dental gun, and the patient get nervous and he feel stress, so it could also trigger it. Supine position for too long, like cardiac patient, you could not lay them for a very long, very straight, very supine. And hypoxia and poor oxygenation due to the patient may have any respiratory disorders, like the patient may have asthma or any COPD. Strenuous procedures, like you are doing extraction with very aggressive procedure, like you do not know when the procedure is very tough, it can also trigger it. Skipping cardiac medications before, like if the patient is like a cardiac patient already, he knows, but he skip his medication before the appointment, before the dental procedure. And underlying uncontrolled heart diseases, like that patient might have any CHD or any other underlying cardiac diseases. So these are the factors which could cause angina. Like angina is not wholly dependent on cardiac issues, it could be other things too, like we discuss it. First of all, you do not have to panic. You do not have to panic. You should be confident. You should have self-control. What you have to do, you have to stop your procedure immediately and follow the protocol for administration of nitroglycerin. Okay? If you have to place the patient in comfortable position, usually semi-supine and sitting upright. Reassure the patient and loosen any tight clothing. Like you have to open his buttons, like tight clothes should be loosened. Check the vital signs if possible. TK, you have to check the vital signs, but it is an emergency, so you could not perform the whole procedure. Could take extra time, but you should do it like site assistant could do it. Administer nitroglycerin like 0.3 to 0.6 mg sublingually. It is a tablet which we put under the tongue, or it could be in a spray form like we do in a buccal, like buccal mucosa. Ask the patient not to swallow immediately. Wait 5 minutes and assess the pain relief. You have to notice the pain is relief or not. If patient persists, repeat. If the patient pain is persist, like you have given the one dose and you have to repeat the second dose after 5 minutes, and then up to third dose you have to repeat the same procedure. It may be cured if it is angina. If it is not MI, it would be the pain would subside, but after 3 doses this is an emergency. Like after nitroglycerin, if it is subside, then you have next step, provide oxygen if available, 4 to 6 liter per minute. If chest pain continues after 3 doses, as we discussed already, or lasts more than 10 minutes, suspect the myocardial infarction, MI. Activate emergency medical services immediately. Consider aspirin if not contraindicated, and train to administer it. Okay, you have to administer aspirin to avoid myocardial infarction. Monitor the patient until the help arrives, like the ambulance or you can say the emergency facilities arrive. You have to assess the patient. You can go for BLS. What precautions, like what mistakes you did, like these things should not happen first. What precaution you are going to take? First, take the complete medical history and ask about the frequency, severity, and triggers of the chest pain. Like ask him about the past dental history, medical history, like this incident happened before. Like you have to do preservation. Like before starting the procedure, you should set an appointment with proper detailed history of the patient. In that step is must. You have to know about the past dental and medical history of the patient. It would reduce the symptoms and causes of angina pectoris. Check if the patient is taking any medication, like you are going to take the drug history, allergic history, nitroglycerin he's taking or not. Confirm that they have taken their regular medicines before the appointment or not. You have to keep an eye on everything. What to do? Okay, like what things you should do to prevent it. Like schedule short morning appointments for these patients, use stress reduction protocols, ensure the good pain control, keep nitroglycerin readily available in your dental clinics, monitor medically compromised patients carefully. They should be treated very carefully. And a proper referral. Yeah, you have to practice this thing in your medical or dental setups very carefully. Like if the patient has unstable angina or recent chest pain episode, elective dental treatment should be postponed and medical consultations is recommended. You have to refer this patient to any medical specialist or physician. If you are not experiencing any specialty, then do not traumatize your patient and be honest and refer it to the proper consultant. Like you do not know how I can do the implant, how I can do this procedure, and you are doing it for your own benefit, not for patient benefit. So this is not medical ethics. You have to follow the medical ethics. You should refer it to the proper consultant, the proper specialist. Consent form, yes, this is very important slide among all of them. Remember, prior to any dental procedure, you should and must have the patient consent form and properly signed and recorded. You must have a written record or recording or anything that claims that the patient has given his consent for the following procedure. This step must be followed. This is the biggest crime in a health department, but we rarely practice it. As in our country, this thing is really practiced. Like we can say you cannot practice the layman dentistry. You cannot practice. Being a dentist, you should follow the basic medical and dental ethics, health ethics, and you have to follow it. And it is also for your safety. If anything happen and they do any case like things, you must have proper record for your safety too. This is safety for you and your patient. Thank you so much for watching. Any queries, like it was a video on dental emergency, angina pectoris. There are a lot of other dental emergencies. We're gonna cover very slowly and gradually. If any question in this lecture, you can ask in the comments and I will explain it very easy. So thank you so much for watching. Bye.